Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The polished bridge is now tried in the patient's mouth. It is checked to see if it is stable and if it seats properly. Then the occlusion is checked with articulating paper, both in centric relation and centric occlusion. Shim stock is also used to check the occlusion, and we should get a catch on all three parts of the bridge, and the teeth anterior to the bridge and on the opposite side of the arch. If we are happy with this, then the margins are checked. There should be 1.5 millimeters of space under the ponic. There should be a contact on the mesial. The margin should be well adapted and highly polished. If we're happy with this, then the bridge is removed to be cemented. In this case, we will be using trial temporary cement. Trial cement is a cement designed for the temporary cementing of permanent bridges. We will ring the molar casting with the temporary cement and put a thin layer on the internal portion of the bicuspid casting. This then is seated on the patient's teeth with finger pressure to push it in the proper area. And then an orangewood stick is used to drive the bridge further down on the teeth. The excess cement then will be wiped away, and the margins can be checked at this time. If you feel that the bridge is seated completely, then a burnisher can be used to burnish the margins. The hydraulic pressure of the cement oozing out of the margins can open them slightly. A 5S burnisher can be used to readapt these margins should they need adapting. With the use of a mirror, we can look at the lingual surface, and you can note the position of the burnisher on the lingual cervical. We try to burnish all the margins that we can get to with this 5S burnisher. The lingual of the bicuspid is handled in a similar manner. We place a cotton roll in the patient's mouth, and they will close firmly until the cement is completely hardened. The excess cement has been removed, and we re-examine the bridge. This is a checkpoint at this time. If this is correct, then the bridge is removed for final check-in. You'll note that the temporary cement acts as a gasket. It comes cleanly out of the bridge and can be removed as a thin skin, as you see here. This should be removed before final check-in. You note the gasket form of this temporary cement. The bicuspid is removed in the same manner. This is cleaned, and the bridge is cleaned. It's placed back on the model and then turned in for final inspection. Now I would like to show you the cementation of a 3-unit posterior bridge in a clinical situation. You'll note in a clinical situation that we have tongue, saliva, and cheeks to contend with. The bridge has been tried in, the margins and occlusion adjusted, and now the teeth are being varnished with copalite. You'll note that the teeth are isolated with cotton rolls. It's very important to keep saliva off of these teeth during this cementation period. We are going to use zinc phosphate cement, and in this case we are using a 10-drop mix to give us sufficient amount of cement. A thin layer of cement is placed in the internal portion of the bicuspid and molar crown. It's important that this cement is inlay consistency so that it will flow very easily and very readily. Small amounts are placed in the cervicals of the bicuspid. Any extra saliva that we see seeping in this area is removed, and the bridge is firmly pushed to place. It is very important at this time to make sure all the excess cement has been removed. In this case, we're using an orange wood stick to drive out the extra cement. Care must be taken on the opposing teeth, and if there are weak teeth or large restorations in this area, then there are other ways to drive the bridge down. A malpack with a large rubber tip can be used to vibrate a bridge down. We do this until no more excess cement comes out of the buccal margin of the bicuspid. When the bridge is down sufficiently, then the margins are finished. A greenstone can be used, rotating from gold to enamel. It's important to do this finishing while the cement is still soft. The hydraulic pressure of the cement oozing out of thin margins can open them up slightly. So any margin that we can get to can be dressed down and burnished at this time. 5S burnishers or rime trimmers can be used to finish cervical margins that are difficult to reach with other instruments. A mirror is used to get lingual access. Also, sand discs can be used to finally finish these margins that have been adjusted. A contour angle also might be helpful in getting the proper direction to a sand disc. When the cement has hardened, it's important to remove the excess cement. This can act as a severe irritant if left under the soft tissue. Dental floss is used to remove the extra cement and to clean out the ponic. The bridge is polished and the patient is recalled in 1 week to check the occlusion and oral hygiene.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.